Good afternoon, and welcome to the latest edition of our Health Innovation Series. My name is Brooke Bosma. I'm the Chief Development Officer at St. Paul's Foundation, and I'm grateful to be a guest here on the unceded traditional territories of the Musqueam, Squamish, and Tsleil-Waututh peoples. We are grateful for their stewardship of this land. Quick housekeeping reminder that this afternoon's event will wrap up with a question and answer. Depending on your device, your Q&A box may be located at the right or below your viewing screen. Type your question into the box and hit submit. If you see a question that you like, go ahead and upvote that question. Click the small arrow to the left of the question and it will move to the top of the list. Submit your questions as you think of them, and there's no need to wait until the end to submit a question. All right. Let's get started. As you know, the theme today is the urgent need to redefine and improve seniors' care. This isn't just an issue for our parents or grandparents. If we have the good fortune to live long enough, it's an issue for us too. Seniors make up almost 20% of our population. During this decade, more than 5 million Canadians will turn 65, and right now, more than 11,000 Canadians are over the age of 100. We're not just living longer. We're living longer with complex medical needs, chronic illness, frailty, and social and cognitive challenges. Case in point, 80% of residents in long-term care have some form of dementia. That's why Providence, with the support of St. Paul's Foundation and our generous donors, is on a mission to transform seniors' care. And I'm proud to say that we're uniquely qualified to do this critical work. Seniors have always been a population of emphasis for Providence. Fully 25% of our patients are seniors. We have 7 long-term care and assisted living homes serving more than 900 seniors today. And we're Providence. We have a 130-year history of providing compassionate care for the sickest and the most vulnerable members of our community. This work is already well underway, and it was when the pandemic hit. And what we've learned since then has us doubling down on our efforts to move the dial and to move it quickly. The people we'll meet today are leading that change. Seniors' care at Providence is managed by an incredible multidisciplinary team that includes our own Dr. Janet Koo and Dr. Heather O'Donnell. As you can see, Dr. Koo holds a number of senior leadership roles at Providence and at UBC. What the slide doesn't tell you is that Dr. Koo is a geriatric specialist and an advocate for good old-fashioned house calls. Dr. Koo says that a home visit is much more than a medical appointment. It's an opportunity to see if the patient is able to get around, if there's food in the kitchen, if the home is clean, and if it's safe. This is the kind of holistic care that distinguishes Providence from its peers, and it gives Dr. Koo a unique lens to shape the delivery of acute care as part of the continuum that ensures BC seniors get the right care at the right time and in the right place. Dr. Koo's co-presenter is Dr. Heather O'Donnell. In addition to Dr. O'Donnell's ophthalmology practice, she's part of the redevelopment team designing and planning the new St. Paul's Hospital. They are curating every touch point so that every patient in our care, especially the vulnerable seniors, will have the best possible experience and the best possible outcome. This careful attention to detail is also being applied to the new Center for Healthy Aging that will take shape as part of the new hospital. I don't want to give too much away, but Dr. O'Donnell envisions the Center for Healthy Aging as a kind of one-stop shop for seniors and their families to get the care that they need. I'd like to add that Dr. O'Donnell also supports Providence's commitment to Indigenous cultural safety and the wellness of elders, knowledge keepers, and their families. She taught practical nursing on First Nations reserves in Saskatchewan, and she delivers eye care to the health-sick community in Bella Bella. It's a privilege to welcome Dr. Janet Koo and Dr. Heather O'Donnell.
Hello, everybody. I'd like to start today by sharing a story of Mrs. Lee in 2021, and to show you how things can sometimes go a little bit awry and how we could do things better. So Mrs. Lee is 84 years old. She walks 5 kilometers a day. She lives independently. She has no family doctor because she's never needed one. She has some chronic constipation and her short-term memory is slipping, but she doesn't complain about it, so she doesn't seek any help for that. Unfortunately, this winter, well, on one of her walks, she slips, falls forward, and they have to call the emergency department. She goes there, and they find that she has a broken knee. It took her all day to get that seen, and in the meantime, she is seen by the geriatric emergency nurse that do pick up that she has some risk factors. So they refer her to long-term care and a geriatric follow-up visit. She's given some painkillers and sent on her way after spending most of the day in the emergency department. This is exhausting. And when they call her the next day to see if she'll come back, she says, "No, I'm too tired. That was too tiring for me, and I'm not going to return to the hospital. I'm fine, and I'll be okay." Unfortunately, 6 weeks later, her niece comes in to see her, and at this point, she's lost weight. She hasn't really eaten. She hasn't really had a bath for a while. Her skin seems to be breaking down. She seems depressed and a bit confused. At that point, the niece becomes very concerned and calls 911 again. And she's brought to St. Paul's again, where she is admitted to our acute care for the elderly unit. But by this time, she is quite confused and has some delirium because of her dehydration and malnutrition. And despite the best efforts of our acute care staff, they have a really tough time reactivating her. She doesn't walk safely anymore. And at the end of 6 weeks, she's still very depressed. And they say, "Unfortunately, Mrs. Lee, you have to go to a nursing home." She unfortunately is placed there where she doesn't do particularly well. She still feels very depressed because she never wanted to be this dependent.
First, there is not a person in this Zoom room who has not observed a loved one, a patient, a family member struggle with navigating the health system. And I would venture a guess that at least part of your reason for logging on today had something to do with the belief that care could be better. Perhaps a curiosity about exactly how you can be a part of the transformation of care that's occurring in healthcare. I'm one of the physician directors of clinical planning at the new St. Paul's Hospital at the Jim Pattison Medical Center. My portfolio includes outpatients, procedures, mental health, medical imaging, and the Center for Healthy Aging, as well as rehabilitation. But I'm also an ophthalmologist in the community, which means that I spend my workdays in the pursuit of helping and healing patients with eye diseases. Many of those patients are older adults. And I'm not a primary care provider, so I don't see my patients on a continuous basis. I see them in short bursts, sometimes months or even a year separated. Seeing patients with large stepwise declines, like the one that Dr. Koo has just described in Mrs. Lee, is far too common. The system and the challenges that patients experience in trying to recover from those stepwise declines are fraught with challenges. We do our best, collaborating with primary care, making referrals, providing low barrier access, but I do believe that we can do better. The vision for the new St. Paul's Hospital at the Jim Pattison Medical Center is to lead in BC's delivery of a new model of healthcare by providing patients with compassionate and patient-centered care where and when they need it most. This hospital is going to open in 2027 and feature many opportunities to take large steps forward in Mrs. Lee's care. This campus will welcome patients to the most modern hospital that BC has ever built. On the ground floor of this building, just to the right of the entrance that you can see here, is like a gateway into this tremendous opportunity. It is the Center for Healthy Aging. The goal of the Center for Healthy Aging is to deliver anticipatory care to proactively prevent deterioration through connections that we simply don't have in our care system today. I'm going to speak to you a little bit about the physical space, and because I realize that this is small, I'm going to walk you through this ground floor. So the emergency department is pictured there in the big red block, and then we have the mental health stabilization unit below that. The main entrance is sort of pictured in the gray central atrium area, and just to the right of the main entrance is the Center for Healthy Aging. This is 1,000 net square meter space. And if you don't know what 1,000 net square meters is, just close your eyes for a moment and picture yourself standing in the center of an empty basketball court. Multiply that by 2. This is a huge footprint on our health campus. The space includes, first of all, this is going to be a tremendously welcoming and accessible space. It's dementia friendly, and it includes both a short stay planning and assessment unit and a geriatric outpatient clinic. This is all designed with older adults in mind. The short stay planning and assessment unit is sort of like a hospital ward, only we don't expect patients to stay as long. It allows access from the community, from emergency services, and from the emergency department, and it includes fully equipped hospital rooms. These rooms will wrap care around the patient by connecting teams of specialist clinicians, allowing them access to the amazing advanced diagnostics available at the new St. Paul's Hospital, and also connecting them to multidisciplinary allied health teams. The Center for Healthy Aging also includes a geriatrics outpatient clinic where patients can continue to receive the scheduled access of assessments and testing that they currently receive in our amazing geriatrics outpatients clinics. This facility will house services that support our vulnerable patients. This is to provide an opportunity that is an alternative to that long emergency visit stay or a long protracted inpatient stay. Now, creating the environment or the physical space for the team to come together is, of course, one enabler along this journey. The Center for Healthy Aging will also house within it spaces for older adults to connect. It has spaces for the types of assessments that promote our ability to achieve the outcomes that matter most to our patients. Better function, better quality of life. We have programmed an activities of daily living zone. It has a kitchen, a washroom, and a bedroom. This is a space that allows providers to see how patients are functioning in a hands-on environment. This sort of assessment is evidence-based. It reduces the impact of injury and illness, allowing providers to truly understand what the functional capabilities of their patients are. It allows them to target their care, supporting the areas that we know they most need help with. The mobility gym allows the allied teams to come together around exercise and rehabilitation. I want to stop for a moment and tell you about another very cool committee that I'm involved in. It's called the Health Systems Redesign Steering Committee. It's chaired by our CEO, Ms. Fiona Dalton, and it brings together leaders in the organization to communicate with groups around the hospital that care for similar patient populations. And we'd been preparing this talk in advance of my most recent Health Systems Redesign Steering Committee meeting, but last week we met with the rehabilitation group. And I just thought I'd tell you a little bit about it. This brought together physiotherapists, occupational therapists, speech and language pathologists. It brought together the physiatry team and professional practice in nursing. This group was so inspiring. Their vision for the ability to prevent pajama paralysis in our hospital where patients simply stop moving and don't get out of bed, to secure for our organization a true culture of reactivation was amazing. If we can build within the Center of Healthy Aging the facilities that these teams need to actualize their goal, I believe the sky is the limit for innovation in rehabilitation care. And what if we took it just one step further? Now, I know this might seem a little bit sci-fi, but virtual reality in care of the older adult is a real thing. There's a recent study done that showed that you can immerse providers and family members in a virtual reality experience that actually simulates the experience of patients that have dementia. And that by understanding, you are able to create empathy and better care for those that are involved with our patients. You can also implement virtual reality simulation experiences for patients so that you can utilize this tool to reduce that experience of feeling locked in a hospital bed. Imagine waiting for your care provider and going on a walk in a familiar forest area or perhaps even your hometown. The hospital is going to have an amazing clinical operations center. This is sort of like a digitally enhanced airport traffic control system. It's an amazing center where we can interface with many technologies throughout the building. It will tell us things like the emergency department visit loads, like the occupancy of all of the inpatient beds. It can tell us about probably even how many parking spots are currently being used. And it can also tell us about the clinical care that's being provided in the hospital. But with digitally connected rooms within the Center for Healthy Aging, it will allow this to go one step even further. We have the potential to utilize technology to connect the Center for Healthy Aging with perhaps even home supports in the community or virtual monitoring, where a concerningly high blood pressure or a very low blood sugar could be flagged before it becomes a major issue. The future of care is so much more than the interaction between just a patient and a provider. And the Center for Healthy Aging is one of these spaces that can really create the shift in the journey for patients like Mrs. Lee. So now I'm going to ask Dr. Koo to sort of reimagine, if you would, what does it look like in the future state?
So Mrs. Lee in the future again falls and is brought to the emergency department, but is identified early as a good candidate for the Center for Healthy Aging and is brought down the hallway to the center first thing in the morning. She gets her own room, she gets breakfast and lunch, and while she's there, she's immediately assessed by a physician and a physiotherapist. They identify that she is constipated and they immediately are able to institute the treatment. She's seen at the center, both in person and virtually, a number of times over the next few weeks. And after the initial pain of the knee wears off, it is quite clear that she has some pain in her hip as well. CT is arranged through the center, and she is seen there, where they find a little crack in her hip bone. At that point, they ask orthopedic surgery to come, who also come down to the center to see her there and advise her that she should be able to walk and give some advice to both the physiotherapist as well as the other physicians. She has a full gait assessment, and that information, very detailed, is given to a physical medicine physician who's able to tailor her rehab program to be the most effective and to lessen the chances of falls in the future. The occupational therapist sees her both in the ADL kitchen to see how she's doing as she has decreased mobility, and does a virtual home visit. Social work sees her and makes sure that her niece is aware of what's going on and is able to virtually meet with the niece multiple times and link her with long-term care as well as some private supports which she chooses to help support her through the convalescent period. She's seen by a rehab aide at home where the physiotherapist can drop in virtually and make sure that the exercises are being done correctly. She is diagnosed with mild cognitive impairment and is invited to join the cognitive resilience group with her niece, which they are able to do both in person as well as some virtual sessions. At the end of 6 weeks, she's improved markedly. None of those negative outcomes occurred. She is independent. She is reconnected with her family physician. She's doing very well, and she stays at home and is discharged to their care. That can be the future. I'll send it back to you, Brooke.
Thank you so much, Janet, and thank you so much, Heather. We are so grateful for all the work that you guys are doing and for the lives that you're changing. A quick reminder, if you do have questions, put them in the chat. And if you see a question you like, go ahead and upvote it. Our next speaker is Mark Blandford, a longtime advocate for innovative, long-term dementia care. Mark's early training as an occupational therapist gave him a unique perspective on seniors care that stems from firsthand experience of how seniors experience day-to-day living. Today, Mark is in charge of ensuring our new model of care answers the most important questions. How do we create joy in someone's day? How do we safeguard their dignity and autonomy? How do we ensure they remain vibrant, valued members of the wider community? Mark's goal is to bring deep and lasting change to seniors care across Providence and to create genuine homes, homes where lives are enriched with emotion and connection and meaning. The kind of home that you would choose for your loved ones and the kind of home that you would choose for yourself. Here's Mark.
Thanks very much, Brooke, and thanks for inviting me today. As Brooke says, my background is in occupational therapy. I've worked with seniors in many domains, both community, home, and in long-term care facilities. And I want to thank Dr. Koo and Dr. O'Donnell for their inspiring vision of the future. The Centre for Healthy Aging is something we can all get behind, I think. But when it comes to that point where somebody needs to be in a long-term care facility, when the Centre for Healthy Aging has done its thing, we need to pick up and give that elderly person a life that they can be enjoyed and can live out the rest of their days in a way that they would choose to do. And what brought me to Providence was not just the fact that we're building a new hospital, but the fact that when you combine the vision of the Providence Healthcare, the support of the St. Paul's Foundation, and inspiring clinicians such as the ones described by Dr. Koo and Dr. O'Donnell, when we bring all that together, we can do something really very special. And it's our hope at Providence to create long-term care environments for people that they truly can have a day well lived. And I think you're going to see shortly in a video that we're not currently doing that as well as we'd like to. But in the future, we have a really big vision. Lots of people talk about this. Many organizations across the country and the world, indeed, are looking to do what we are doing. But we have a unique opportunity in Vancouver at the new St. Paul's, with Providence Healthcare in our new builds, and in the new dementia villages that we're envisaging. With the support of the St. Paul's Foundation, we are uniquely placed to do something very special. So I hope you'll enjoy the video we're about to present, and we'll be back shortly afterwards to discuss it. Thank you.
When I get older, I would like to be treated with respect and dignity.
Just be treated like how I'm treated now, really. I don't think the aging process doesn't change who you are.
I think it would be very hard if a person hadn't had a full life. You know, they'd be trying to play catch up.
It does take courage to live into your elder years. You've lost some of the physical abilities you had. You may have lost some of the mental sharpness, and people judge.
I think families are trying their best to keep their loved ones at home. But if you have kids and a life and a full-time job and your mom has dementia and she's leaving the oven on, it gets kind of tricky.
The long-term care needs a redefinition. We are now waking up to the fact that our elders have been neglected for a very long time. Sooner or later, it's going to be us who may need to live in these sorts of situations.
The last 30 years have just disappeared. I'm 84 now. I've lived here 5 years. The first year I was in a different wing. It was a 4-bed unit, and that was very difficult, very difficult.
We call it the medical model, the institutional model. The model of care based on large buildings that house many residents in settings that really are not anything at all reminiscent of a home. We like to call them homes, but if you walked into them, you would actually think you were in a hospital. To imagine that it's anything less to elders who are being cared for in those situations is just not realistic.
Institutional model of care is built for the efficient care of the masses. So sometimes that personhood is kind of downgraded a few notches, and their medical condition or their surgical procedure seems to be the paramount thing.
Sadly, their physical needs seem to take precedence over their emotional needs, their spiritual needs, their needs for things that are beyond basic care.
Sometimes when you get caught up in like, oh my God, I gotta get like 12 people up and so-and-so's got, so-and-so's family's coming, so we gotta get them all done, and it's just this constant juggling of time.
We know we're on a bit of a schedule, but we're also relaxed. I'm aware that the girls always have 6 to 10 other issues on their mind. They don't talk to me about it, but I know.
They all want to do their best too, right? Because there's like, well, I would never treat my parents this way. So they all have their own kind of expectation. So when they can't meet those expectations, they're pretty hard on themselves.
And now they're wearing those masks, it makes it harder.
In healthcare, we run often at very fine margins. Our systems are dependent on there not being too many crises, but COVID has taught us that the crises can be long.
None of us at the time had any idea that there was anything to protect us, and certainly nothing to protect our elders, who really died at very dramatic rates, which was a very sad situation. It really put the spotlight on how these elders were living in their facilities, sharing a room with anywhere from 1 other to 3 other residents, separated only by a curtain, and the rapid spread of infection was borne out in those types of situations. So it really is not a way for elders to live.
A pandemic takes away the living part of life. We're forced to isolate people in their rooms. We've been forced to isolate people from their families. That's the challenge for us going forward. Maintaining that safety, that level of rigor that keeps people safe from a thing like COVID, but we have to find ways to maintain the living, the quality of living that is so important to human beings.
We need to move away from medicalizing the end of people's lives, and the shift is towards the social needs.
And the social care has to shift that to being less time efficient and more focused on that individual controlling their own day.
We've got great research from around the world. We know the kind of buildings that work.
There are a few models that are in existence across the globe. One of them in the Netherlands, it's called De Hogewijk. It is a typical village concept, a situation where elders live in small homes with small numbers of fellow residents and live a life that's much more natural. It's truly creating a small home for a small family of residents.
All the homes have 12 beds, 12 rooms with private bathrooms. There'll be a common area and a kitchen that they have access to. We're going to be changing how many people walk through those areas to try to normalize their lives. Like, you don't have housekeepers and you don't have laundry staff walking through your house at home, so they shouldn't be having that here.
So making our facilities and our services appear less clinical, less medical, but still maintaining that medical clinical rigor that people with that level of complexity require.
There'll be a coffee shop there where people from the external community can come into our internal community. And there'll be play structures to try to welcome families when they come in to bring their children. There's going to be a daycare there, incorporating youth with the residents.
It's going to create a natural hub of activity that will be in itself stimulating and interesting, not just for the elders themselves who will be exposed again to the world outside, but in fact it will also help to expose the children of tomorrow or to the elder part of our population.
We're talking about changing a culture of care that's focused on what the resident wants in the moment versus the list of tasks that the worker has to get through.
The infrastructure that we have is not only old, it's wrong. It needs to be corrected. This is going to require redevelopment of virtually every site in the province, if not the country, for the social needs of elders.
It takes courage to get old. It definitely is not an easy process.
I think the biggest thing that it will give for most people is that they won't have to fear living in a care facility the way some people currently do. I think they will see the care facility as an extension of their own home, hopefully. They'll see it as a place that honors their values, their traditions, the interests that they have. And I think they'll see that we can convert our compassion and our hard work into also a day well lived for the individuals.
There's a divine hand that's leading you, whether you believe it or not, and you go with the flow and you learn what there is to learn.
You can't physically touch the success that we're going to have. As supportive as the government is with all of the demands they have, they just can't give us all the funds that we need to do all that work. So I'm extremely grateful to the St. Paul's Foundation for the funds that they already provide us, and hopefully for the funds we'll get in the future. And I'd say to those donors that funding elder care may not be as sexy as a CAT scanner or some other large medical device, but what you will see over the years to come is the life experience of those elders we're looking after, which could very well be your loved ones or you yourself, be something you can be proud of and something that we can be proud of. Great. Well, I think you noticed the guy in that video was a lot older than me, and hopefully they'll get it right next time. So we've got a few minutes now just to ask Dr. O'Donnell and Dr. Koo a couple of questions, and we'll maybe just talk a little bit about some of the themes that have come up so far, and then we're going to go to questions from the Zoom world. So keep your questions coming in, and we're tracking them as we're talking right now. So Janet, we've talked a bit about the Centre for Healthy Aging and how it's going to change the way care is going to be experienced, and we'll come back to that. But the video we've just seen talks about how long-term care is going to change, hopefully through our vision and the work that we're going to do. The pandemic put a spotlight on long-term care in a big way, and you in your current role, you've been involved in that a lot. What lessons do you see us building into those new long-term care facilities that we've learned through this last year and a half?
Thanks, Mark. We know that the experience of seniors in our long-term care facilities is really driven mostly by the relationships they build the activities that they do. And we need to have the infrastructure that lets us provide that for the seniors and their families in a way that is still safe and anticipates that there may be future challenges that, like we've had with COVID, so that we can maintain that quality of life for people without having to give up any safety or specifically around infection control.
Yeah, and I guess you'd agree with me that we can probably get to a place where we deliver a great life and a great day, as well as maintaining all of those standards that we need to now make sure we do.
Exactly,
Yeah,
exactly. And we're often limited by aging and old infrastructure.
Exactly. So Heather, another thing that came up earlier was just looking at how the new St. Paul's Hospital, and particularly the Centre for Healthy Aging, will fit into the bigger picture vision for more holistic seniors care. Any thoughts on that?
Thank you. Yeah. I think when we think about wrapping care around the patient, this is a really fundamental shift in how we organize ourselves now when we're caring for our patients. When you think about even just the way we structure our hospital, we have we group all of our surgeons together, and we group all of our medicine specialists together, and then we group all the maternity specialists together, and there's a renal group and the urban health group. The future state looks more integrated than that. It says, what are the common problems that this patient has, and how can we bring the necessary providers to them? And I think when you look at things in that integrated way, you can then say, all right, what does the patient population journey look like? And you can support it across the whole spectrum. If we're only focused on, a particular disease, say a hip fracture, patient comes into the emergency department, they have their hip fracture dealt with, then they get back in, then they're back into the community. I think the idea of the care for the older adult being an integrated patient sort of program where providers that are common to that patient population rally around the entire patient group is going to make a big difference in connecting them before they need that acute care and ensuring that we wrap care right back to the community.
Right, so it's moving us away from that program-specific silo, we like to use the word silo-specific care, to care that makes sense for that individual
for the patient
along
population.
their journey.
Totally.
Yeah, and I like what you were talking about in terms of the linkage to the community, because that's something that we certainly notice at my end of the business, and that is that we tend to not connect the dots very well, and it becomes more random. And you experience that, Janet, I think, as a geriatrician. You see people falling through the cracks when we miss things, not because we intend to, but because the system just isn't there. Does that ring true?
Yeah, there's a lack of connection between people that we think we can be the hub for, particularly people that are in crisis. And the other thing is that everyone that's sort of gone through this has experienced the repetitive sort of, well, you already asked me that, and someone else already did that. So this lack of communication and lack of coordination between different services, different parts of our care system. And we think with the Center for Healthy Aging, we can really try and fix and smooth some of those journeys for seniors and their families.
Yeah, I know you've told me many times about visiting home, doing home visits with clients and seeing a multitude of healthcare business cards on the fridge.
Yes.
We want to get to a place where it's one card, one number, one place, and that will be the Centre for Healthy Aging. What would you both say to donors to help them understand the incredible scope for the Centre for Healthy Aging? Thinking about donors often are looking for something tangible, but this is more about changing the way care is experienced. How would you describe the difference in the Centre for Healthy Aging to a donor who's maybe new to it?
Yeah, I mean, I think, if I could, it's like, we're not talking about just small pieces of the puzzle here. We're talking about the whole journey and the path. It's the yellow brick road of older care. It's the actual, it's the opportunity to create a pathway that doesn't exist in our healthcare system. It's about so much more than the mobility gym that for sure on its own makes a difference for patients, and we have that amazing rehabilitation structure now. But what we don't have is the ability to bring patients together with their primary care provider connected virtually, and a hospital system that knows that there is an ophthalmologist across the street in the Clinical Support and Research Center that can be available when it's identified that they have vision loss at that same time. This is an opportunity to really enhance that model of care. Does that make sense?
It makes total sense, and it's a very exciting vision. Janet, any thoughts?
Well, we have excellent clinicians at Providence Healthcare, people in geriatric medicine, psychiatry, rehabilitation, and palliative care, but we need some of those tools to be able to work more effectively than we are now. That ability to connect people, the virtual care that we've gotten good at, but we can use so much more effectively to lessen the number of visits that people have to bring to do, lessen the burden that they feel in terms of transportation, that sort of thing. So that, if we have those tools, then the clinicians can do their work and be the experts that they need to be to get that care and to improve quality of life for the seniors.
I loved what you said earlier about virtual home visits. Somebody who's done many home visits and struggled with things like taxis and getting people in and out, to do a virtual home visit sounds pretty cool.
Yeah, and then to be more efficient with we're always going to have relatively limited resources. So for a physiotherapist to do 7 or 8 home visits in one day and still do everything that they need to back at the center would be amazing.
That's pretty cool. Well, I think it's probably time for us to go to some of the questions from the virtual world. So maybe we'll start with maybe at the top of the list, a question from Cecilia Moore, which has got lots of good votes. How can we also support and keep seniors at home? Can we have an interdisciplinary team, including spiritual and palliative care, go out on calls to provide holistic support in the home? Well, I think we've said you can, but anything to add there?
Well, I think the mix of in-person, at home, as well as bringing people in to wrap care around them when they do come into the center, as well as sort of a mix of virtual visits. So using every tool, and depending on where the senior lives and what the circumstances of them and their families, we'll be able to tailor the care and a complete holistic plan. So I did mention OT, social work, PT, but obviously all interdisciplinary members can participate: speech language pathology, spiritual care, nursing, all sorts of other clinicians.
Yeah, excellent. And of course, families being involved in care is something we like to see more of. Next question is from an anonymous person, but it's a very insightful question. We've seen how important it is for seniors, especially seniors living in care, to have visitors and a sense of community. How do family and friends and volunteers factor into this new model of care? And yeah, we've certainly in the last year had great difficulty with the COVID situation, allowing families or having families into our care homes. And a lot of that's to do with design. Our design isn't set up to prevent infection with lots of people coming in and out. Hopefully in the future our new designs will be able to do that. But any thoughts, Heather, on that particular question?
I have 2 thoughts about it. One of them is that currently, I know at Mount St. Joseph's we do run like a caregiver support program, and that sort of programming is definitely central to the sort of core values of the Center for Healthy Aging. The idea that we can not just support individual patients, but consider their context is sort of fundamental to making this sort of the best it can possibly be for our patients. Having an opportunity to engage families in care is a critical piece of this puzzle. The other thing that I'd say is that with the amazing IT infrastructure that is possible, you can bring more people into the circle. You know, without a digitally connected patient room that allows for multiple consultants and those digitally connected friends and family members, it gets a lot harder to sort of have everybody arrive at the same time. When you have those, the IT infrastructure really does facilitate and leverage, we have the opportunity to leverage technology here to bring the people that need to wrap care around the patient to the patient when when it works for the patient.
Yeah. And certainly technology we can't even envisage right now. 7 years from now, who knows what we'll be using.
Completely agree.
Yeah. Another great question. Would the Center for Healthy Aging be offering programs? This is by Modi Louis. This question, thank you, Modi. Would the Center for Healthy Aging be offering programs that assist seniors and their family members in understanding and introducing technology to seniors' independent living? And certainly I can talk to our hopes for technology in our long-term care settings. We're hoping to be using technology to allow people with dementia to freely wander in ways that they really can't do right now. Many people will observe people with dementia in care facilities exit seeking, trying to leave, being barred by locked doors. We want to try and eliminate as many locked doors as we can in our new buildings. And that's going to mean really envisaging and visioning new ways of using technology, new technologies. So that's something that isn't currently funded through the core funding we get from government. So certainly in the long-term care sector, we're certainly looking at that.
Yeah.
But at the Center for Healthy Aging, I think we've probably talked a fair bit about this, but how do we help family members understand the use of technology, Janet?
Yeah, we'll have to see, technology keeps changing every year and we're seeing new things all the time. It's pretty clear that some technology is invented by Silicon Valley and really isn't easy for a senior to use. It probably will get a little bit easier as the demographic shift changes, but it's always going to be necessary to have families integrally involved in using any technology appropriately so that we get the maximum amount of impact. Because it's no use if a machine or a robot or something sits on the dining room table. It's just a waste of money. So we need to really bring the family into every aspect of all of our programs. And that will be sort of easier to do in an infrastructure like the Center for Healthy Aging.
Excellent.
I really think one of the things that this kind of brings up for me is thinking about some of the meetings that Mark and I have had around like some of the partner organizations in planning the Center for Healthy Aging. When the community starts to hear about this integrated space, I feel like I get an email a week from another organization in the community that's like, hey, can we talk to you about this amazing thing that we're doing, whether it's like the Center for Brain Health at UBC or the kinesiology program and their GATE lab. And like the opportunities in the community are so rich around IT. And I just think that having this amazing integrated space provides partnership opportunities that are much harder to kind of corral, if you will, when we're talking about siloed spaces all around the hospital. Like, it's very difficult to sort of envision kind of really robust partnerships in the way that it's so seamless to envision them in future state. So these are we have these very rich conversations with people who can't wait to be a part of the care that's going to be delivered. And this kind of, I envision that with IT as well, community partnerships and community centers that say, oh, we want to take part in connecting our community to the Center for Healthy Aging.
Yeah, and I think the point you're making there is that care for seniors is way more than just the formal healthcare system. Mm-hmm. It is about the community and all those other partners coming together. And yeah, I've certainly had some of those emails and some of those contacts. And I think there's a question that from an anonymous person asking, how can I contribute to learning more about these areas, and how can that person contribute to what we're doing? You can. I think you need to reach out to certainly the St. Paul's Foundation, and we can connect you and talk to you about how we can partner with you as an organization or individuals to create the kind of care continuum we're talking about. It is beyond the formal healthcare system. Just looking at some more questions here. Is the Center for Healthy Aging only for seniors? Good question. How will this new care help people whose health status ages them decades before their chronological age? That's a really good question. I'm going to throw that one straight to Janet.
Thank you. So the first point I wanted to make is that palliative care will be an integral part of the Center for Healthy Aging, both outpatient as well as the day sort of assessment programs. Obviously, not everyone who benefits from palliative care is older, especially if they have a life-limiting illness that unfortunately affects them when they're under 65. I think we want to look at aging not from just a number of years point of view. We are very focused on frailty and also prevention. So preventing frailty from either occurring or getting worse. So I can envision that we could be having prevention sort of activities for all sorts of ages, especially into the middle ages, where we know that having chronic disease, poor health habits will eventually cause frailty and poor function. And so that will be part of our sort of full spectrum of services, while also making sure that we do address frailty in those people that have become frail, both that are coming to our acute care facilities and in the community.
Yeah, exactly. Thank you, Janet. A question, another anonymous question. This scenario assumes no wait list for the Centre for Healthy Aging. I'm not sure we do, but what is the capacity for admission? Would you anticipate a waiting list with the increase in seniors in our community? I think what we're saying is if we do things differently, we can minimize wait lists. I don't think wait lists will ever go away, but Heather, you deal with wait lists all the time.
I do.
Big part of your life.
I think, we're not, because this is such a beautiful, net, new space, we have to remember that some of the amazing things we already do well still exist. So not every one of our older adults needs the Centre for Healthy Aging. Sometimes a hip fracture is a hip fracture with exceptional supports at home that doesn't require all of these things. So I think it's about identifying the patients that really need it and delivering care to that group. Is capacity going to be an issue in the future? Sure, it's possible. I think that the opportunity we have here is to build the infrastructure that optimizes the function of the space so that we can better manage it. Because as we think our way through design, the more opportunity we have to put in exceptional virtual care hubs. As it stands right now, funding virtual care booths that are sound siloed for care providers to have a virtual visit, they're super expensive, and they probably right now it's hard to imagine that care can occur or that our current rooms aren't going to need to be the care spaces. But if we had the dollars for it, you could have within this big floor plate a zone of virtual care rooms that would increase the capacity. So I think it's about kind of envisioning more and expanded capacity with the space that we have if we have that opportunity.
Yeah. Thank you very much, Heather. Another question that's popping in, I'll just read the second one first. 6 people are responding to Jocelyn Huber's question. Since the pandemic, my elderly father has been living with us, and I'm wondering if you have any suggestions or advice for families caring for a senior at home. Well, we don't have time to give you a big list, but this is Janet's stock in trade, so we'll hand that one to her.
It is a huge job caring for a senior at home, I think. It can be overwhelming, and people do need help. I guess my advice would be, obviously I don't know your situation specifically. Everyone's situation is a little bit different. There are certainly resources both in the community, accessible through your family physician. We have a number of services that can be referred to at Providence Healthcare. And then long-term care, actually anyone can call their community care in Vancouver or Fraser Health and ask for help. There is help out there. Unfortunately, right now, as we've talked about before, it can be very disjointed and confusing. That is part of what we want to address with the redevelopment. We're trying to do the best we can in our present system. I think we can do even better with our new facilities.
And a similar question, anonymous question coming in, Janet, somebody whose mother has heart disease, high blood pressure, regular wound care, exactly the kind of person that would end up coming, hopefully. How would the new approach help this individual?
Yeah, this is the essence of patient-centered care. What you've described is the problem that we aim to solve. It is the vision for the new St. Paul's Hospital at the Jim Pattison Medical Center. This is what we're doing. This is our jam, is providing both the infrastructure and the support within our hospital to ensure that patients aren't experiencing this sort of disjointed care. And I really hope that throughout the presentation we've convinced you that this is exactly the sort of model that will exist at the Center for Healthy Aging.
Yeah, but that person asking that question is certainly experiencing exactly the problem we're trying to solve.
Like
right now, you do have that phone call that Janet described. You can call whichever health authority you're in, and the system will start to help you. And the system's pretty good, so I would encourage you to make that call. But our goal is to make that, whatever comes after that phone call, more effective, more efficient, and more tailored to you as an individual. Our time is getting very short right now. And I see we've got a nice comment describing how much Cecilia Moore likes the video. And she says she wants to give a shout out to Dr. Ken Takano and the stars in the video. Yeah, those individuals all work in Comox. Dr. Takano works obviously here in Vancouver. And I thought he looked very dashing. And I will tell him that you enjoyed his performance. But one more question. With the Dementia Village, would you be able to care for people who are completely dependent, meaning unable to stand or control bodily functions, limited communication, swallowing challenges? And so I'll take that one. The answer is yes. The Dementia Village is being developed under provincial policy. So people being cared for in the Dementia Village have to conform to the care requirements that we're mandated to deliver. So that would cover all of those things. So our hope is to be able to deliver high levels of complex care, such as the question you described, Christine, but also those other things that we do will make dementia more livable, and as we've said, ensure that that individual has a day well lived. So I think we're at an end. Thank you. We didn't get to all the questions that came in. Thank you very much indeed for everybody who took the time to ask us questions. I'm going to thank Heather and Janet for their time today, and going to hand it back to Brooke.
Thank you so much, Mark, and thank you, Janet, and thank you, Heather. We are honored to have such talented people working at Providence and really looking towards the future. Of course, thanks to all of you, everyone who joined us this afternoon. We especially appreciate your great questions. I hope now you feel inspired and you feel hopeful about the future of seniors' care. With your support, we're making sure that life's journey continues with meaning and with grace for our residents, their families, our caregivers, and the entire community. Thank you so much for being with us this afternoon.